Nutrition and health promotion. The following are the objectives for this chapter, which we will cover in the following PowerPoint slides. Health problems related to poor nutrition and lifestyle factors. Anemia can be caused due to a lack of iron or folate intake. Cancers can be due to an increase or high level of fat, a decrease in complex carbohydrates in the diet, or an increase in alcohol or sedentary life, or people who use tobacco. Constipation can be due to a decrease or lack of fiber in the diet, or an inadequate fluid intake in the diet. Diabetes mellitus can be due to an increase or high calorie or fat intake, a decrease in carbohydrate intake or lack of carbohydrate intake, obesity, and sedentary lifestyles. Arteriosclerosis, hypertension, and high cholesterol can be due to high fat intake, a low fiber intake, a high sugar intake, and a high alcohol consumption rate. High cholesterol, hypertension, and arteriosclerosis can also be due to tobacco use, obesity, and stressful lifestyle. Osteoporosis can be due to a lack of calcium in the diet or inadequate vitamin D intake. And stroke can be due to a high fat, low fiber, and complex carbohydrate intake, and also people who have a high alcohol consumption rate or consume tobacco or have a high stress environment can be more susceptible to stroke. Why we eat the way we do. It is important to be sensitive to personal reasons. There are a bunch of personal reasons as to why we eat. A lot of it is dependent on convenience, cost, emotional comfort, our routine, and a positive experience, meaning there's a fond memory behind a certain food or dish that was made within the family or while a person was growing up. Background, culture, religion. Some people grow up with these foods. Some examples are Asians grow up more with whole grains, rice, noodles, seafoods, and tofus. They don't have any dairy in their diet. Latins grow up with more corn and potatoes. Mediterraneans are more on fruits, vegetables, and seafoods. Mexicans are high on tortillas, cheeses, but they do not regularly consume milk. Hindus are also forbidden to eat beef, so these are just a couple of examples of that. And then there's a psychological component, which we talked about as far as those fond memories as a child. You grew up eating, for example, grandma's potato salad and can't give it up. Nutrition and dietetics. Nutrition is the nutrient intake and use. Nutrients are organic or inorganic chemicals in food that supply energy. There are phases of metabolism. Metabolism is a process of nutrients that are used at a cellular level for growth and energy production. There are two phases. There's anabolism or building, and then there's catabolism, which is breaking down. An example of anabolism is the liver creates glycogen. Catabolism, breaking down, is when an example would be glycogen stored is then broken down into glucose. Digestion is the mechanical and chemical processes that occur in the stomach, mouth, or small intestines. Nutrient absorption is usually in the small intestines. Some absorbable forms of nutrients are amino acids, fatty acids, glycerol, and glucose. And the definition of dietetics is the practical application of nutritional science in individuals. Nutrients, all diets needs can be met within a balanced diet, so eating the proper things throughout the day, you can meet all the nutrient requirements of your body. However, this is highly unlikely in our society today, so many of us do need supplemental. Function of nutrients, they provide sources of energy and fuel, supply material and build and repair body tissue, and they regulate our metabolic processes. Carbs, fats, and proteins are the only things that can give our body energy. And we base our basal metabolic rate off of the amount of energy used by a resting person to maintain vital function. So what is the bare minimum that we need in order to function in our daily life? There are different categories. There is essential and non-essential. Essential cannot be manufactured by the body and must be included in the diet. We have to eat it every single day. Non-essential can be created by the body. For example, cholesterol and also vitamin D can be created by the body from the absorption of sunlight. Nutrient components. Calories and fat are some of the most important aspects to pay attention to when selecting food. So when we have our nutrient components, there are 7 major components. There's carbohydrates, fats, vitamins, minerals, water, and fiber. It is recommended that we have as little fat as possible. And vitamins, we pay particular attention to vitamins such as folic acid, vitamin D, and then the minerals calcium and vitamin A. The reason why we pay particular attention to folic acid is due to anemia and neural tube defects in pregnant women. And the reason why we look at calcium and vitamin A and vitamin D so closely as far as minerals is because it's highly linked to osteoporosis further in life. Carbohydrates should be 55 to 57% of our diet. Is divided into 3 groups based on complexity of molecules. We have simple sugars, which are our table sugar or honey is considered a simple sugar. Our complex carbohydrates, such as our starches, glycogens, or fibers, these are our whole grains. Also, milk contains a significant amount of complex carbohydrates. Vegetables such as potatoes, beans are included in this category, and also fruits such as apples and bananas. Dietary fiber is recommended that we get 20 to 35 grams a day. Most of the population in the United States falls well short of this. Fiber cannot be digested or broken down into our system. Therefore, it helps us create and promote regular bowel movements. It decreases our likelihood of diverticulosis, and it decreases our likelihood of constipation. There are 2 different types of dietary fiber. There is soluble fiber, which is our fruits and vegetables. This decreases our chances of heart disease because it combines with a cholesterol molecule in the intestines, which prevents its absorption into the bloodstream. So it decreases our cholesterol. Insoluble fiber, this is considered our whole grains and beans. This is what really promotes our regular bowel movements. And then carbohydrates are our main energy source. They regulate fat and protein metabolism. So we need our carbohydrates in order to digest our fats and our proteins. Fats are 20 to 35% of our diet. When fat is metabolized by our body, it produces ketones in the blood serum. Storage is in the form of fuel and is more concentrated. Dietary fats are needed to absorb fat-soluble vitamins such as A, D, E, and K. Fatty acids are the building blocks of fat. There are saturated and unsaturated fatty acids. So saturated fats have all their hydrogen molecules attached to them. Most of these are animal byproducts such as our meats. Insoluble fats unsaturated fats most of them are manufactured or hydrogenated and cause plaque in our body. We have our monosaturated fats, which should be used as much as possible. Our unsaturated are missing the hydrogen molecule bonds. Examples of our unsaturated fats are olive oil, canola oil. You will hear the terms monosaturated fat and polysaturated fat. The difference between these two is the amount of hydrogen bonds they are missing. We also have trans fats, which help make food taste better and it lengthens the shelf life. Polysaturated oils are solid at room temperature, whereas the other ones are usually liquid. Cholesterol is from polysaturated or monosaturated, which is good. Our trans fats and saturated fats are bad. So our LDL levels increase with unsaturated fats and decrease the HDL. Examples are margarine, olive oil, and canola oil. Our LDL should really be under 100. If you are a heart patient, a lot of physicians will tell you that the LDL will need to be under 70. But for a normal person, it would be 100. And oatmeal is one of the most effective foods that a heart patient or a patient with high cholesterol can eat. Studies have proven that oatmeal can decrease the cholesterol significantly. Some of our plant foods that we can get fats from are avocados or canola oil. And some of our more processed foods are margarine and butter. Antioxidants, they protect against oxidizing free radicals that are created from pollutants or tobacco. We must have a significant amount of these in the body. They are found from vitamin C, E, and beta carotene, which is found from yellow or orange raw vegetables. And they protect against some cancers and macular degeneration. Proteins are about 18% of our diet. Women should have about 45 grams, and men should have 55 to 60 grams of proteins. Some of our weightlifters or people who exercise quite frequently may need more protein in their diet to help with muscle recovery and repair. Amino acids are the building blocks of protein molecules. There are complete amino acids and incomplete amino acids. They help build and repair tissue. Protein aids in the body fighting against disease by creating antibodies. Protein regulates fluid and electrolyte balance, provides energy when carbohydrates and fats are stored or depleted. Most Americans eat double the amount of protein that they actually need. Excess can either be converted to glucose and burned, or it's stored as fat in the adipose tissue. Some examples of proteins are meats, nuts, and eggs are the most common. 1 tablespoon of peanut butter equals 1 ounce of meat. There are also a number of protein supplements in protein powders and granola bars. Red meats are high in fat and generally are not recommended, especially with those with high cholesterol. Vegetarianism and adequate protein. Vegans must have vegetable proteins. They build meals around protein. They try soy-based beverages, and they try meat substitutes. There are different types of vegetarians. There's lacto-ovo vegetarians, which eat eggs and milk, yet lacto-vegetarians eat milk but not eggs. And then vegans eat no animal proteins or byproducts, so no eggs or milk or any types of meat of any sort. Vitamins. So there are fat-soluble vitamins and water-soluble vitamins. Fat-soluble vitamins are A, D, E, and K. Water-soluble vitamins are B-complex vitamins in that group and are vitamin C. They are needed for metabolic processes of protein, carbs, and fat. They are known by their letter designation and do not cure illnesses. So vitamin C helps in prevention, but they do not cure illnesses. More beneficial in foods than in supplements. So if somebody can get it from a dietary dietary food in nature, we rather do it that way than supplement it through a pill. And these vitamins can oftentimes affect our prescribed medications. So if we can get it through our foods and drinks, we rather do that because the interactions are a lot less than if we were to take it in pill form. Vitamin K can also be produced by intestinal bacteria. Vitamin D we can get from sunlight, and vitamin A can be produced by beta-carotene. Water-soluble vitamins are excreted through the kidneys. Our fat-soluble vitamins are generally through the stool for the most part. It is important to instruct patients not to overcook vegetables that may contain these vitamins, as it can destroy the vitamin content, especially in water-soluble vitamins. When are vitamin supplements needed? Vitamin or mineral deficiencies. This is commonly known in our vegetarians. They usually lack vitamin B12, D, iron, and zinc. Iron and folate for pregnant women. We will oftentimes have to supplement that to decrease the chances of neural tube defects such as spina bifida. Calcium from the lactose intolerant. Vitamins for elderly such as calcium and vitamin D. Post-surgical or burn patients. Strict vegetarians, already mentioned that, and then gastric bypass recipients, they oftentimes lack vitamin B12, protein, and iron. And vitamin K intake can interact with the medication warfarin, so we have to instruct patients to keep that intake consistent. So we would not want them to take an additional supplement if they were on warfarin. Minerals, 13 are needed to be healthy. Water helps with water and electrolyte balance, the acid-base balance within our body, regulates muscular and nervous activity, it helps in blood clotting, and regulates the heart rhythm. Our largest minerals in our body are sodium, potassium, calcium, phosphorus, and magnesium. Magnesium is typically stored in our bones. Some of the smaller Vitamins are iron, zinc, copper, selenium, chromium, manganese, iodine, which is important for thyroid health. We oftentimes get iodine from our table salt, and fluoride. So some of the recommendations are potassium are 4,000 milligrams a day, sodium 1,800 milligrams a day, calcium 1,300 milligrams, magnesium 400 milligrams, iron 18 milligrams, phosphorus 1,800 milligrams, and zinc 14 milligrams. Water, 80% of our body consists of water. We can go longer without food than we can water. It is involved in all of our body processes. Electrolytes are often lost, especially if someone is profusely sweating and not getting adequate fluid intake. These imbalances can be life-threatening. The recommendation is 8 glasses of water a day. Water helps regulate our body temperature. It acts as a solvent or a medium for most biochemical reactions within our body. It acts as a vehicle for our transport of substances, and it acts as a lubricant in our joints and mucous membranes. Dehydration due to the lack of water is usually diagnosed by a tugger of the skin.